Welcome to the office. Brian, welcome to the office.
Thank you, sir.
Nice to meet you.
Nice to meet you, too.
You're coming from Flow with the Keys, you said?
Yes, sir.
All right.
I used to train jiu-jitsu like really frequently, and I sustained what I think I wrote on that form, costochondral separation, perhaps.
Okay.
There is a bulging knuckle of a rib right there that you will feel.
We'll take a look.
And if I kind of dig underneath, I feel like the rib has healed something along these type of lines.
When was the injury? When did you break it?
2016.
2016, so we're 2022.
Yeah.
All right.
Yeah. In that position, during the healing time, like I would occasionally kind of lean back, and it was like, oh gosh, but it felt really, really good. It would almost like, I feel like pop back into a good position, but it was constantly like slipping. Okay. And then I feel like where it ultimately fused was here. Everything that's happening from that, I've developed probably a side slouch. It feels to me like this hip runs high. I don't have too much pain like right at the contact site, like that doesn't really hurt. If I was to lay down on a hard surface and do like, you know, that
on your
exercise,
stomach?
Yeah, it's really jamming.
How about on your back?
My back is in misery 24 hours a day.
No, like that area hurts when you're on your back?
It wraps around.
It does?
Yes,
okay.
For sure.
Treatment was what?
Man, I feel like I've done a lot. I originally went to an orthopedist, and the x-ray said that it was a cartilage where like the ribs connect. It wasn't the bone itself that broke.
You didn't fracture the bone, you just had a separation.
Correct.
And this is going to remind me of one of my first cases in my first week in practice. 20 years ago. We're going to talk about it later.
Old school.
We're going old school. Yeah. That's your number one reason for coming here, Brian?
Yeah, everything that's downstream of it. I think that's the catalyst. I think that's where it all began, and I think 5 years or what the gap is between 2016 and now of just compensation and the body trying to figure it out, and me continuing to do jiu-jitsu, taking up kite surfing in Florida, which when I put the harness on, it's brutal. It just digs in. Every time I jump, I feel like stuff just like slip, and if I do anything active, the pain just goes through the roof.
Okay.
Haven't been able to do jiu-jitsu for years. Struggle through the kiteboarding, even though I love it. It's like one day on, several days off.
Ankles, knees, elbows. I'm sure whatever.
Yes.
Do you want me to do whatever I find?
Absolutely.
Or
I'm only giving you one known trauma. It spider webs through a whole bunch of things that I know you'll find without me telling you.
Okay.
The ankles, yes. Like I have been told twice, and I do need to probably deal with this. I've broken this foot twice. Okay. And
when was the last time you broke it?
A couple years ago.
Okay. Doing what?
I fell down a flight of stairs. A break here, and then just a lot of like kind of ligament damage. Still really kind of crunchy. Both times I broke it. The first time I was in jiu-jitsu was here.
What else?
Good
start.
That's it. Yeah. I mean, you'll find some stuff in the neck. I was in a jet ski accident. 2017. I was knocked unconscious, tossed in the water, and I had a lot of like kind of dizziness, like lightheaded stuff. That's actually what had me take the spill down the stairs. I got like a woozy thing and like lost my equilibrium and went. I was getting a lot of like kind of pins and needles down the left side after that, but that's largely gone. There's still a spot right about, if I find the right spot, like if I just touch my own pressure, it's like electricity.
You feel it, yeah?
Yeah, like a pinched nerve probably or something. Right?
Yeah, okay. We'll take a look at it.
Cool.
So here's what we're going to do. Let's go over your x-rays.
Go.
Let's explain what we find.
Go.
You said you have had care before. You've had x-rays done in the past for any of this stuff?
Shockingly, with the amount of chiropractors I've been to, not one has decided to take an x-ray.
Let's get right into this foundation and see what we got going on. So yes, we do see we have some curvature stuff going on, right? Mm-hmm. And we're going to get to that rib you said on the right side in a minute.
Yep.
And the first thing I do is if we're looking at things that are correctable on this x-ray, we run a line straight through, okay? Mm-hmm. From S1 all the way to the dens. Mm-hmm. If this crosses the dens, that means the body has already compensated to this curve. There's nothing to correct this curve, okay? If this was lined up here, that would have been your thing. But the fact that it's even off a couple millimeters is enough to tell us that there is some correction that may occur. Okay? On the side profile, we're looking at posture. And we're running the plumb line or the posture line from L5 through 7 and 2, and yours actually line up.
Okay.
So your L5 is here, okay? And this line here should go through 7 and 2, which tells me, at least for this, whatever's going on in your body, you have the right curvature on your side profile. And this is what's most important. This is actually really important. So people ask, when we look at these two curves, okay? And if you look at your A to P curve, which is this one looking at you from behind, versus your side profile, okay? If we're looking at this x-ray here, you can have perfectly straight spines that are healthy on this x-ray. You can have curved spines that are perfectly healthy on this x-ray. You can have curved spines that are sick. You can have straight spines that are sick on the AP film. On the lateral film, we are designed to have these 60-degree reciprocating curves. Okay? So the curvature on your lateral film and the posture line are a better indication of status, health status, than the AP film. The reason I'm pointing that out for you is this. So yes, you have curvature issues here. But the fact that you have the right curve on this x-ray is why you've held up. Mm-hmm. Okay? Let's look at this. All right, let's look at your foundation. Do we have a level base and foundation in order to have a stable building? A little bit off, yeah?
Yeah.
You can see the crease of the bum is here. You can see the pubic bone is slightly to that left side. You can see it's a little bit whiter on the right side, yes?
Yeah.
A little shorter, little drop on that right side.
Yeah.
And I see it's coming from right here.
Okay.
S3, S4, right there.
Okay.
Okay, let's look at the numbers. We have a measured difference of 6 millimeters, so the right hip is dropped down 6 millimeters. We have a rotated pelvis on the left. We have a rotated sacrum on the right with a drop sacrum on the right. That's your tailbone injury. So, this is called an auricular surface, just like the ear. Yeah? When it goes down, it wants to go out. When it goes up, it wants to go in. I'm referencing this bone here, the PSIS, to the lateral sacrum. Okay? Now, if it goes down and in or up and out, definitely a trauma. No ands, ifs, or buts. Down and out, up and in, could be trauma, but could also be posture.
So I'm in the definitely trauma category.
There are definitely at least two, at least two.
Yeah.
So at least one on the right, one on the left. Now, regardless of the traumas and misalignments and the short leg, it's under 7 millimeters, adjustments will hold. That's the magic number. That's the threshold that Gonstead found. Dr. Gonstead found anything under 7 millimeters, adjustment will hold. If we correct the pelvis, we get it to 5, even better. If we get that and get that as well, then we get it to 2 or 3. I don't know yet.
Right.
Okay? Does that make sense, sir?
It sure does.
That's your foundation. Now let's continue up. Once your foundation is sorted, so that slightly dropped leg on the right and your L5 is what creates this curvature. So we look here. You can see L5 is tilted on that left side, yes?
Yeah.
And so we have to stabilize your foundation, then get to your 5. Maybe we get to 5 on this trip, maybe we wait till October, I don't know. Okay? But this curve is a compensation to the foundation. Now, ooh, the fun stuff. Yeah, look at that juicy one. Alright, so part of this curve does this. That's your T12 rib.
That's the one that's connected to what's broken in the front?
I don't know yet. Here's the interesting part. This rib is lower than what you're saying. Ah, interesting. So you're telling me here,
right,
the 12th rib doesn't go here. You also told me it wraps around.
Right.
T12 rib doesn't wrap around. Neither does T11 because those are floating rib, guys. You got it? Follow me? So the lowest it could be is T10.
Okay.
So T10 wraps around.
Okay.
T11 stops back here. 12 is back here. Okay?
Yeah.
Now let's go to yes. So this is more 10.
Okay.
Cool?
Yeah.
And it ends at the xiphoid, which is the bottom of the sternum,
Yes.
that little point.
Yes.
That's T10.
Okay.
Cool?
Yeah.
Good lesson. Okay, here we go. Well, you may like my answer, you may not. I don't know. So this is 12, yes?
Yes.
You can see these are all
That
kind
looks
of disconnected,
totally off.
right?
Yeah.
It's because of this curve.
Yeah.
And so what's happened over time is what? Over time, you've stretched out these capsules.
Because of the curve.
Correct, because of the curvature compensating from the foundation. Now I'm going to share one of my first cases.
This totally tracks with pain that I feel. Yeah. Especially like when I jump on the kite, I almost literally feel like the rib is like slipping out in the back. Yeah.
Yeah. And I want to share this thing. It's really important.
Cool.
Because in all my years thus far, there was one case, my first week in practice.
It's always the first.
That it was always. So my mentor at the time, Dr. Working, he was the big extremity guy. God rest his soul, passed away. First week I got licensed in Illinois. Here, Rahim, practice is yours. You get it for the week. So anyway, I saw about 300 patients that week, right? First week out.
Yeah.
Cool. And this one guy, you don't remember everyone you help, guys, doctors and students. You help so many people over the years, you forget most of them.
Yeah.
It's the ones you didn't help that you remember.
Haunt your dreams.
Okay. So this guy, big farmer guy, tractor guy, right? Big guy like this, wide guy. T10. Left side, capsulitis, had an injury, comes in once every 7 to 10 days to get it adjusted because there's no fix for it. That's not your case, I'm just saying. This is what it reminds me of.
Sure.
So he comes in, gets set, comes in, and I was by myself, and he's like, all right, you gonna get it? I'm like, yeah. I went too light. I went,
Oh boy.
hold on. This is the lesson, guys, and
Yeah.
this is why I do what I do. I want you guys to get that. So I do it. Goes in spasm. Freaks out. I freak out. I'm like, first week, I just got my license. This guy's in spasm. He's like, Doc, that wasn't it, dude. Because I can't breathe, can't move. So the other doctor comes in, that was also the other associate doc. And he was a year ahead. He's scoping him, he's doing it, trying to figure it out. We couldn't figure it out. Massage therapist comes in, ended up massaging him for like 2-3 hours. Finally calmed him down. Week later, doc gets back. Doc goes, I heard you had a little incident. I said, yeah, what? He goes, okay, Rahim, I told you don't hold back. Ever. Okay. Guy comes in. And he sees me, he's like, he ain't touching me, right, Doc? He goes, you got me. I said, yeah. He goes, yeah. Goes down and he just sets it right in there. So like precise and firm. And the patient looked at me, he goes, that's what you need to do. Okay. 2 weeks later, I had the practice again that day. Guy showed up. And he's like, oh shit, you gonna adjust it? I said, yeah. Put him down, smacked it. And I just went for it as hard, as hard as I could.
Yeah.
I went as deep as I could. And we said it, got it. And he goes, that was it. And that was my lesson.
Mm.
So whenever something like that happens, it's not that the next visit I'm going to hold back. I'm going to actually go deeper as the patient's going to allow me. That's the lesson.
Yeah.
Now, in your case, the rib adjustment isn't even going to hold right now.
Yeah.
You already know. You see why? Because of this.
Yeah. It's too far away. It's not gonna.
The curvature.
Yeah.
So this is going to be a little bit of work.
Yeah.
But I'm hoping to get you at least some good relief here.
Awesome.
There's another little piece of the puzzle. 3, 4, 5.
Yeah.
3, 4, 5.
I feel a lot of pain.
Diaphragm alive. That diaphragm is controlled there. It was a fight.
Fire on.
I got it. I'm a poet.
I know it.
I know it. All right, jokes aside. Does that make sense what I'm saying, dude?
It really does.
So, we're not touching your rib today or tomorrow even.
Makes sense.
We're totally working as much as we can on that
Yep.
vertebrae, and your table is the knee chest table of choice. Aha! We got another piece of the puzzle. All right. T1. T2. T2 is a culprit of the side slip. 3. T4. T5 is a culprit of the side slip. But T5 also levels out from this curve, so I'm not buying it. Damn. Can I give you some good news?
Yeah,
Your
please.
discs are really good, dude.
That's great.
5 is great, 4 is
good
great.
space there, yeah.
All great space, but you see they're all kind of tilted, right?
Yes.
Very subtle. And all of that is coming from there and 5.
The foundation, yeah.
Okay, so your discs are all fantastic there. I like that. A little bit of an old compression injury there, but all good. Disc is good. Disc held up. That looks like a culprit right there.
Is that around here?
Yep.
One thing I'm realizing I forgot to mention, but on the form, I get like a heart jolt occasionally. And
Palpitation?
I find, like, yes, and I find like digging in this region with my thumb while like lying on my right side. The only thing that helps if I sleep on my right side, I will jolt out of bed with like a palp.
Yeah, you know why? There's another good finding. I had a case like that too. I'm just spewing out all kinds of history today. Part of that is this curvature going into the side of the heart. Oh, here's the other piece of the puzzle. There's your neutral neck.
Yeah.
Your neck curve is actually decent, dude. Your discs are great. This one is a tiny bit less, yes?
Yeah.
And there's a little bit of traction osteophyte on the back, so that tells me...
That's probably that electric spot.
Mhm.
Yeah.
And that's when you rub it or you push it, you said?
Yep.
Extension is when you feel it more because it pinches in the back there.
Mm-hmm.
And now, but that's not the answer for the fix. Here's the answer. These all move forward, right? That one didn't move, correct? But neither did that. So same thing, either 6, but maybe even 7.
Yeah.
5 is a result. 3, 4, 5 keeps the diaphragm alive. So 5, this could be a compensation that's been there a while that's affecting.
Yeah.
Okay, so we'll take a look and you'll report back to us. All right, so we can see that dimple. I don't see that dimple much. This crease is higher, this crease is lower. Relax the hands. This shoulder more pronounced. Let's see. You said you and the keys?
Yes, sir.
All right, let's see if you got the key wiggle. Let's walk it out.
I don't know about that.
I'm looking at your dimples, right? When
Yeah.
you walk,
Yeah.
do you move your hands when you walk, or are they
It's like a
fixated?
Seinfeld episode.
Yeah.
Probably being a little more rigid than normal.
Okay, just keep walking. So he swings that, he actually swings his leg, his right leg. You swing it when you walk, and you're on your back right heel. Those are the shoes you normally wear?
Yeah, or none at all.
Cool. Yeah, so you swing that right leg.
I'm aware of it now. You're saying
You see it, right?
Yeah,
Or you
it's
feel
a
it?
post and swing,
It's a
which makes sense since that's what I broke twice, all the times in the boot and whatnot.
Mm-hmm.
That crutch.
And again, you can see the right dimple. I can't see the left dimple in your back. And you kind of do this. You shift. So that's the wiggle.
Yeah.
Not even a wiggle, it's a shuffle.
The Florida shuffle.
And back over here, have a seat. Nice and easy. Head down, please. Starting at the base of the neck. Oh, it's just 20 points.
It's a lot.
Yeah, it's a lot.
To the left, right?
Yes.
So,
That's down low around T8, T9. Maybe T10. Ooh. We don't want to mess with that. Sit back for me, please. 11 points, S3, S4, T9, T10, and C6, C5, C6. Feet together, scoot forward, please. Open and close the knees, feet are touching. Open and close. Good, open and close. Left side only, make sure your feet are touching. Left side, open and close. You can totally see it. He does the left, the whole right is shifting. That's it. Right side only. This is not moving. This is rotated right sacrum. Scoot back for me, please. 1, 2, 3, 4, 5, 6. 9, 10. That one more. Round your back, please. I almost want to say that one, dude.
Yeah.
11, not 12. It's starting there.
Yeah.
Right?
Yes.
11. Listen. It's a thud. It should be a hollow sound. Like that. That's the lung field. 11. All right. S3. Back towards me. L5. L5. S1. S2. S3.
Ooh!
S4. Sounds like a penguin. Coming to that.
That was an L. Ooh, that's
3.
That's yeah.
4.
Both are pretty bad. I think 3 might edge.
But 4 is also, right?
Yes.
So if we got 2 bad joints, where do we go? If you have 2 bad joints, you go to the lower one first.
Got it. We got
Okay.
foundation up. We got
Foundation up,
Yeah,
exactly.
makes sense.
So here's the game plan.
Yep.
C6, T11, S4.
It's like a intense game of bingo.
You ready?
Yeah, I'm ready. Let's do it.
Bingo. Palms up, receive.
Receiving.
The back of my hand is what they receive. The crack files make you believe. Oh, I'm going to get so many comments on that one. Look at that. Look!
Something.
Gotcha. Nice. And by the way, that was actually going on the setup.
Yeah, I felt it.
What did that tell you?
That it was ready to receive.
It was ready to receive. Walk it out, sir. But look, he's starting. You can start to see that left dimple now. It's kind of cool.
I feel a little less swinging of the right.
A little less, yeah?
Yeah, a little bit.
Let's get a little more.
Okay.
Hold there. And I gotta push that shoulder up as much as you're gonna let me. We're doing a rotated sacrum. And we gotta torque it up.
It's working.
That's it, dude. Come on up. Walk it up. T11. Now, here's the trick on T11. It's a PR-T. That's the trick. Because you can't set it as a PR into a concavity. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Oh, jeez. Oh.
Right there. Now, I'm going to take all that tissue out of the way. We're going to be right on that transverse. Gotcha. You okay? Good. He's fighting a little bit.
Yeah, I'm trying to.
Gotcha. Nice. Come on up. It wasn't so bad. You got that left hip swinging now properly. I'm excited for you to actually see it. As you're walking, a little different, yeah?
Yeah. Consistent heel strikes.
One more time.
Consistent, like, heel. As opposed to.
Come back over here, have a seat. So you want to know the interesting part?
Yes.
Interesting.
Yes.
Interesting. C6 is wedged on the right, C5 is wedged on the left. You're feeling C5, but it's C6.
This is the up here.
No, this is here.
Okay.
So you know how you're feeling that pinch there?
Oh, yeah.
But the wedge, 6 is wedged on the right, 5 is wedged on the left.
Uh-huh.
I'm going to set 6 on the right first.
Okay.
And then we'll see. Okay?
Yep.
C6. Da-da-da-da. Da-da-da-da. Nice and easy there. You crack your own neck a lot. Firm.
Oh!
Hold on.
I heard that one.
Really?
Yeah.
Did you hear something? I didn't hear anything. Bend to the
Must have
right.
been one of those poppets.
Bend to the left. Let's get a little bit more. Mm-hmm.
Oh! That was it.
That was it.
Oh, that was it. I feel like cold liquid is coming out of my right ear. Warm liquid.
Deep breath. All right, style, brother.
Yeah, what's happening there? I'm super curious.
Oh my God, it was 20.
Yeah.
Tell them, camera person.
It's clear.
What?
It's clear.
Hold on.
What?
Clear.
Clear. Neck is clear. Ah! Tell them.
Clear.
Clear. Tell them.
Clear.
Nope.
No.
Oh. You know why? Tell them.
Clear.
Clear. Just needs ice. Check it out. All the way back. Limbo contest down in the keys. S1. S2. Different.
Yeah, that was excruciating.
S3. Remember that?
That was the worst one.
4. 3.
What?
2. What? Straighten out your legs, please. Raise your right leg. Relax. Raise your left leg. I'm getting a lot of people from Florida though, dude.
Really?
Yeah. I don't know. It's just a lot. Ears.
I always wondered what that felt like.
Scoot back. What did it feel like?
Oh!
I just had to stop that ooze from coming out of your ear.
It worked.
There you go. Nice. Walk it off one last time. Make sure you're good, and then I do your buff and polish.
Awesome.
Very nice. You good?
I'm feeling pretty good.
Awesome. Have a seat. Let's buff you out. Vibration therapy. Magic frequency is 170 hertz. Squeeze. Squeeze. Elbow. Posterior. Posterior ulna. Posterior distal ulna. Posterior distal radius. Posterior lunate. Posterior lateral scaphoid.
Oh, that's that
Squeeze.
computer wrist.
Okay, squeeze. Relax there. Lunate.
Oh!
Scaphoid. Close your mouth, boy. Squeeze. Squeeze. There you go.
Those were incredible, those last ones.
Nice. We're working on the extensor mechanism, okay? So you're keeping your hands straight, slight extension, use the rubber band, and you're just doing extension of the wrist. But watch this. You want to be like, not like this.
Okay.
You want to be slightly like that. Keep the fingers straight when you do it, straight. You can start at the knuckles. As it gets easier, get closer to your nail beds. 100 a day each.
Okay. We'll do.
That's
Waiting
it.
for the famous line.
Welcome to the office.
Thank you.
You got it.